I'm hoping, can you see the screen?
Yes.
Okay, so thank you very much, Justin, for raising me at this time of day, which I've never seen before. It's 5 o'clock in the morning here, and it's very dark. But thank you for inviting me to talk about something, and I've decided to talk about the neurophysiology of fatigue, since I think it has some relevance to the work that you do with nerve injury, and of course with trying to restore neurological function in patients with spinal cord injuries. Now, first thing to talk about is the fact that everyone understands the idea of fatigue, but in physiological terms, we talk about it as an exercise, as it says here, an exercise-induced loss of ability to produce force, which means the desired amount of force within a muscle or a muscle group. It's generally important to think about these as actions derived from the central nervous system. So there may be several muscles involved, several agonist muscles involved with producing the desired force. And the diagram at the right-hand side shows you that there's quite a pathway from the idea of performing a movement to all the way down to the actual muscle, which will be performing the action. And we can't ignore the fact that there are sensory afferents in the muscle, in and around the muscle, which influence the role of the central nervous system in exercise and force production. So it's not just muscle fatigue which occurs during some of these exercises, and not just muscle fatigue which determines the ability to perform exercise. It was recognized quite a while ago that there are mental factors as well, and during the performance of muscle exercise, there's obviously a decline in the amount of exercise that can occur, but they also realized that with some form of excitement, either an inducement to try harder or something else, one can improve one's performance in exercise. And it was also found that when force was lagging, electrical stimulation of the peripheral nervous system, the motor nerves to the muscle, could produce a stronger contraction. So it was clear that there were other things going on. And this is an example.
That was in the setting of just exercise-related fatigue in a healthy patient?
Yes, this is okay. Right. Yeah, so I'm talking now about healthy people. And in fact, most of this discussion this morning will involve healthy people, not people with neuromuscular disease or any other kind of bodily disease. And this example is quite old now, from 1890, and it indicates the ability of a finger with flexion to lift a 3-kilogram weight. And each of the spikes on the screen here indicate the force that is produced by this attempt at movement. And you can see that, I hope you can see, is the cursor coming through, by the way?
Yes.
Okay, so there's obviously a decline, which is somewhat linear in the beginning, but drops off fairly rapidly at the end. But when I mentioned earlier that there's clearly a role of conscious effort to produce these forces, here's the following day trying to perform the same action after a morning of lecturing. One presumes a whole morning of lecturing where one is mentally fatigued by that, and there's a much more rapid drop-off of force here. So there's a relationship between fatigue, if you like, in other areas of the brain, such as cognitive, which can influence motor function. And I think most people can attest to this in one way or another. And we will talk a little bit about that later on. So anyway, getting back to physiological fatigue, as the original diagram showed, there's a role in the central nervous system, which she is shown here on the left, and that's called central fatigue. And the definition indicates that it must be voluntary, of course. So it's strictly speaking the reduction in the voluntary activation of the muscle during exercise, and I'll talk about how that is measured in a short while. And then there's the fatigue which occurs at or distal to the neuromuscular junction, shown here, which predominantly means within the muscle fiber. It's generally clear that the neuromuscular junction under normal physiological circumstances is not a potential limiting factor for continued production of force. So when we talk about peripheral fatigue, for the most part, we're talking about what goes on within the muscle tissue itself. And my main interest and the main focus of this morning's talk is going to be on the neurological aspect of it, which for the most part involves the central nervous system one way or another. So I mentioned earlier that in the course of declining force output during an active movement, it's possible to give an electric stimulus to the motor nerve, at least, and see an increment in force. And this is called twitch interpolation technique, and it's illustrated here with the motor nerve stimulation on the left-hand side. So this level right there indicates the amount of force which is being produced by the subject. And during that force, so while the force is being maintained, if an electric stimulus is given, one can get a small, depending on at what point of fatigue you are, a small increase in the amount of force which is seen here. And that is compared, these are superimposed. This is a montage of various things, but this is the control twitch, which is to say that when the muscle is relaxed, and depending on the size of this depends at what point it is measured, but let's say it's done before the exercise, before there's fatigue in the fresh rested muscle, the size of that controlled twitch, which is the force produced by electric stimulation of the nerve, is related to this small increase here, and you get a percentage of that. So this much extra force during the voluntary contraction as a ratio of the size of this control twitch gives you an idea of what additional force is available during the muscle contraction. And I'll be talking a little bit more about this later on, but exactly the same sort of thing can be obtained with cortical stimulation via a transcranial magnetic stimulator. And again, this is the control twitch, but because of various factors, it's necessary to have a very small contraction going on. So it's not at rest the way this control twitch is, but when there's this very small contraction, you can get the sort of maximal size response from the muscle. But nonetheless, the same principle applies in that the additional force which is obtained by stimulating the motor cortex here, this small little increment related to the size of that, gives you an idea of how much extra is potentially available for force production during the course of, in this case, a maximal voluntary contraction, a ratio of that. So that's the twitch interpolation.
So can I clarify for a second here, just so I'm following well? So he's trying to generate the maximum force. Yes. He clearly is not generating what's available in the muscle end of things. So if you add an extrinsic stimulus to the muscle, you can generate this additional piece. So there's a delta between what he's generating centrally and what that muscle can do just being directly stimulated.
Yes, exactly.
And it's not really at the nervous system output level, because if you do it with transcranial magnetic stimulation, you still see the same. Would you say it's the same amount of additional force driven?
Well, it's not really possible to equate these two, okay, because of the peculiarities of cortical stimulation. They don't necessarily relate exactly to each other. It might become a little bit more clear as they go along, but nonetheless, you're right. It does indicate that there is additional force potentially available from the muscle, especially when you do the motor nerve stimulation. But it also indicates that there's potential force available from the motor cortex. So the central nervous system is running a little short, if you like, as far as the amount of output which is occurring.
Something before we get to the motor cortex output, something in the central nervous system is not engaging all of the motor cortex that it normally would to drive that contraction.
Yes, and when you say normally would, that's another point to be included from this, which I will also get to as we go along. But this is very important for people to understand that the technique and potentially what it indicates. And as you rightly point out, it does indicate that there is some reserve, if you like. Something is being held back in the central nervous system, which at the very beginning even is present, and more will come from about that as well. So here's an example of a maximal voluntary contraction. And I should point out at this stage that there are various ways to study fatigue, and it sort of falls into several categories. One is a sustained isometric maximal voluntary contraction, which humans don't do very often, but it's the simplest and easiest way to study it. The second is to look at prolonged submaximal contractions and see what happens as one fatigues and trying to maintain a force which is not, initially at least, the maximal force, so-called maximal force, which is available. And the third way is to do dynamic contractions, you know, back and forth, like cycling, for instance, or just repeated elbow flexions, something of that sort, which is a bit more natural, but a bit more complicated to study. So here's an attempt at sustained maximal voluntary contraction. This little spike here is the control twitch of this here. So in other words, before
what muscle are we looking at?
The elbow flexors.
Okay.
Yes. I could later get into the reasons for why certain muscle groups are studied, but elbow flexors are particularly attractive, mostly because they have two, maybe three fairly simple agonists, which are easy to control and easy to stimulate peripherally and relatively easy to isolate centrally with transcranial magnetic stimulation as well. But anyway, the point is that this is the controlled twitch, which is produced by, in this case, it actually might be tetanic stimulation, but nonetheless, it's peripheral nerve stimulation. And the first thing to notice is that this is supposed to be the maximal that one can get from peripheral nerve stimulation, and it falls short of the actual voluntary contraction. So it's important to realize that even when you're using tetanic stimulation, say, you don't get the most out of the muscle that you could if you were actually driving it yourself. And that has a lot to do with the arrangement of the motor system, in that the asynchronous firing, for instance, produces better output than tetanic stimulation. But that
can I ask a question on that?
Yes.
So if you're looking at elbow flexors, I'm imagining that when you voluntarily recruit, you're also recruiting brachioradialis and brachialis and coracobrachialis, and you're recruiting some things that you might not directly recruit with stimulation. Does this hold true across all different muscle groups as well?
Yes, potentially, which means that there are very few muscle groups in which this whole thing is as clean an experiment as you would like. Simply because it's hard to isolate all of the agonists with peripheral nerve stimulation and also with transcranial magnetic stimulation. So it's not as clean as one would like. But it is important to realize that peripheral nerve stimulation gives you an idea of how much force is available from the muscle itself, but it doesn't always measure as much as you might get through voluntary contraction, and hence it starts way up here. But obviously over the course of sustaining a maximal voluntary contraction, it starts to fall off very quickly, as you can see. So in other words, fatigue starts very early. It's very difficult to maintain a full maximal force for more than a few seconds. and it starts to drop down like this, and then they say, okay, you can rest, and the force drops off, and another one of these stimulations is performed. And so you might be able to see that as this goes on, clearly the amount of voluntary force is declining fairly linearly as it goes along. But so also is the peripheral output from direct nerve stimulation, but nowhere near as much. It's actually quite a slight drop off as this goes on, but there's quite an enormous amount of drop in the amount of voluntary force that's produced. And the bottom graph shows it perhaps a little bit better. You can see that the peripheral nerve twitch down here is much lower than it was in the beginning, so that indicates some degree of peripheral fatigue, which I'm not particularly interested in talking about this morning, mostly the neural stuff. The other feature on this graph is that at some point, just before they know they're going to let the fellow or woman stop performing this, they ask for a surge. So you can see that when they're declining like this, but they say, oh, they specifically encourage a surge in activity, they can get up a little bit higher. And this is another indication that the central drive to the muscle is dropping off, but with some additional excitement, if you like, that can be increased, but clearly not back to baseline, but it does make a measurable response, and it seems to be getting a little bit larger as you go along as well, which indicates that some of the drop-off is not only can not only be accessed by encouragement, but the amount could potentially change as well. Anyway.
So there's an effort-related drop-off in addition to this decreasing available central drive.
It doesn't. Yes, the important thing is that it doesn't feel in your head like you are slacking off.
Okay.
Because you know, assuming that these are very well motivated subjects, it doesn't feel that you're deliberately holding back. Like in other words, your desired effort, how much you're giving, seems to be maximal, but they realize that, you know, with some additional motivation or some deliberate attempt, they can increase it. So something is shutting them off over which they have some access to make these sorts of increments occur. So it's of course important to keep encouraging people throughout here like that, but this is really to illustrate the point that something's going on which you can access, but over which you don't necessarily feel that you have that control until you do it. So the first point is back earlier, in that the existence of an additional amount of force, either through motor nerve stimulation or cortical stimulation, if this is supposed to be maximal, but you can obtain a little bit extra, that indicates that what you produce as maximal voluntary contraction force is actually less than maximal evocable force. Does that make sense?
Yeah.
In other words, when you think you're doing your darndest to produce as much force as you can, your central nervous system, and it's obviously related to the central nervous system because you can get it from both peripheral nerve stimulation as well as from motor cortical stimulation. So there's a central reserve right from the start, and this is called central activation failure or some version of that. In other words, even when you're not fatigued, when you're fresh, there's still a little bit of extra force available that you might, with training, be able to access, but it would require training to do that.
Can I ask another question about what looked like a little bit of a discrepancy? So the earlier graph with all your central drive before this, with all your central drive, you were still not accessing some of the muscle which you could add by peripheral stimulation. And then in the next slide, your peripheral stimulation is never going to give you as much drive as what you're driving centrally.
That's right.
Do those contradict one another, or am I thinking about that wrong?
Yes. Well, the fact is that there is this is supposed to be central. This is supposed to be the maximal voluntary force, but it's clear that it is not. But it's a very small increase, but it's related to that motor control twitch. So this twitch is the standard against which the additional force is judged. So yes, it does look like there is some degree of contradiction there, but it's somewhat of a failing of the twitch interpolation idea. So it's not exactly clean. There are these small discrepancies that are difficult to explain, but nonetheless,
but you're essentially adding just a little additional increment. So it would never outdo voluntary control, but you're adding a little additional increment of force by the additional stimulation. But if done without the voluntary control, it would never match the amount of force driven by voluntary control.
Yes.
Okay.
And I should probably at this point point out that the amount of central activation is variable between people, quite variable between people, as this next graph will sort of show you, but and variable between different muscles, and it's sort of estimated that about the most that anybody can actually produce is about 95% of maximal evocable force. In other words, for most muscles, for most people, you're falling short at least 5% of what's actually capable. But with training, both the central and peripheral endurance can be improved, mostly in the central nervous system. And this shows the effects of weeks of training down here. The maximal tetanic force, which I've said is not entirely perfect either, does increase over time, drops off here at the end for some reason, but it does increase over time, and that's the peripheral endurance which has improved. But you can see that the central effect is somewhat greater, so that maximal voluntary force after a period of training actually increases as well. So this is trainable, both in the central and peripheral nervous system. And it would appear that most of the effect of training actually occurs in the central nervous system. So you're not necessarily improving your muscle function as much as you think. You're just doing a lot better with your central drive. So what does happen to produce this? Well, during a sustained motor muscle maximal voluntary contraction here, if you can isolate a single motor unit within the muscle, in which case this is adductopolysis, you see that it's firing at this rate up here in the first couple of seconds, but by the time 60 seconds comes around, it's firing much, much more slowly. And one would think that this is the reason why force is dropping off, because it's just slowing down. But this is actually is the basis of the idea of muscular wisdom, if you've heard of that. The motor unit firing rates do slow, but the amount of slowing coincides, as you see down here, with the relaxation time of the muscle. So it does appear that the central nervous system is in some way adapting to the change in muscle relaxation time, something which is occurring peripherally. The motor unit firing rate is adjusting itself to follow that. And this actually is an adaptive procedure, which is something which is designed to continue to produce as much central nervous system output and get as much out of the muscle as possible. So when the relaxation time slows, as it does, then that means that the tetanic rate of stimulation from the central nervous system needs to slow down, in other words, to accommodate to that, so that it can maintain good amount of force. And this is another indication of that. It starts off potentially as very fast, but rapidly declines in a somewhat exponential type of fall off here. And at this point, some additional encouragement is given, which correlates with what I was showing you earlier when people are exhorted to give a super extra effort and the firing rate goes up like that, but nonetheless, it still continues to decline. So this is a way of adjusting the rate of firing to better suit the relaxation changes in the contractile properties within the muscle, so that a maximum force can be continued. But as we know, that doesn't work very well, but it still is adaptive. Nonetheless, force continues to fall off. Now,
so to understand that one better, if you're going to sustain a contraction, it's easier to sustain it if the motor units are firing at a slower rate. Is that a reasonable way to interpret that?
Yeah, that's another way. That's the sort of flip side of it, which is that, and what that simply indicates is that if you don't start off with maximal voluntary force, in other words, if you're asked to just sustain maybe a 30% of maximal force contraction, the motor unit firing rate will be less. And so there'll be less slowing potentially needed there, or at least the slowing won't occur as rapidly as it did here within seconds of a maximal voluntary contraction. So one of the other reasons why you can sustain a submaximal voluntary contraction for a longer period of time. But nonetheless, this happens with all voluntary activities. Slowing does eventually occur. Now,
and the number of motor units recruited, does that change in that scenario as well?
Yes, so I did add this extra point here, which yeah. So some just not only stop slow firing, they stop as well. And of course, we know that within muscle there are motor units which are resistant to fatigue, slow twitch ones, for instance, and the higher recruitment order motor units are fatigue sensitive. But it's assumed that when you start out with a maximal voluntary contraction, everything is firing.
Yeah.
The slow ones and the fast twitch ones, and the fast twitch fatigue sensitive ones are firing as well. So clearly they're going to be the ones that drop out first. So yes, there is motor unit dropout at the same time. Now,
and the definition of slow twitch, does that relate to that frequency of firing, that they cannot fire beyond a certain frequency?
Oh yes, yeah.
Okay.
So the nervous system, or the motor system is nicely ordered, you know, and many in the audience will be familiar with the Henneman size principle, and the size principle applies more or less throughout, and includes the fact that the slow twitch motor units are exactly that. They twitch more slowly, they therefore fire more slowly, but they can sustain their twitch for longer periods of time. So, so this has been studied with surface EMG quite a bit, and the things here in this upper part indicate what happens with any voluntary contraction, be it maximal or submaximal. There's a slowing of muscle fiber conduction velocity, which is in part related, well, it is actually related to the slowing of motor unit firing and the twitch relaxation time. But motor unit synchronization also occurs, and this is something which is important in sustaining or trying to prop up the force that's being produced. The effect on the power spectrum of surface EMG, and by power spectrum I mean breaking down all the frequencies that are present within the interference pattern of the EMG into individual frequencies. The mean or median frequency of that power spectrum drifts lower, and you can see that that occurs here. It sort of seems somewhat linear there, but in other cases it can seem exponential as well. So this goes along with the with the slowing of the motor unit firing and the change in the twitch relaxation time, and sometimes contractility time changes as well, but twitch relaxation is more more robust. It's seen much more easily. There are other changes which occur in the surface EMG, which I've listed here. I don't think I'll go into it very much, but as far as the amplitude is concerned, theoretically, in the maximal voluntary contraction, there is no extra amplitude to be obtained. You can't get extra amplitude out of it. It's supposed to be starting off at maximum, and it can only go down from there. And that's exactly what happens. The amplitude of the interference pattern of the EMG, say something down here, starts to decrease. And as a reflection of that, something called a derived thing called the root mean square, or RMS, also goes down. Not so in the submaximal contraction. And it's one of the interesting points about the submaximal is that you can see what the central nervous system is trying to do to maintain the force, and it gets harder and harder as you go along, even to maintain some fraction of maximal voluntary force. And so the amplitude might increase, but generally the RMS value, which is again a calculated value from the EMG signal itself, tends to increase, and that's a result of increased. Does that make sense?
You froze on the very last second there. Can you say the last sentence once more?
Yeah, sorry. The root mean square measure of the surface EMG of the muscle increases as fatigue develops during a submaximal voluntary contraction. And that's in part because of additional recruitment. You have to bring in extra motor units, which you have in reserve, since it's a submaximal voluntary contraction. And it can also start firing those motor units more rapidly. And all of those things essentially build up the amount of signal. And you don't see that in the maximal voluntary contraction because everything's maximal right from the start.
Okay.
All right. And that's expressed down here. RMS is going up in the submaximal. Force is going down, and conduction velocity is going down. I won't bore you with those things any further. So to talk about central fatigue, one can split it into spinal and supraspinal. And in the spinal side, what we're trying to say is that something is going on around the alpha motor neuron to change its output in such a way that it has to at first accommodate to the slowing of the muscle fibers. But we know that since central fatigue occurs, that although that actually is partly compensatory, it doesn't make up enough. It can adapt to the slowing of the twitch relaxation of the muscle fiber, but it clearly falls short. And these are some of the inputs from sensory afferents from the muscle, what all going on while the descending corticospinal drive is continuing. So that's occurring at the spinal level. But also,
let me clarify on that one again, because earlier you talked about the transcranial magnetic stimulation giving you that full muscular contraction. Was that right?
Yeah, well, yes, right. It measures the amount that's apparently potentially obtainable by stimulation of the motor cortex, indicating that the motor cortex itself is not being activated maximally.
But it never showed a decrement with there being this concept of a spinal level fatigue. If you had a spinal level fatigue in between the motor cortex and the muscle, wouldn't that say that that transcranial magnetic stimulation response then should taper off with time?
Yes, exactly. It does. Because,
oh, it does. Okay.
Yeah, it does. This is just splitting it up to try and understand what's going on. So if you like, the thing which indicates the net output from the central nervous system is the motor nerve stimulation. And the thing which describes the net output from the motor cortex is the transcranial magnetic stimulation. But those things are not going to be exactly the same.
Okay.
So again, going back to the spinal, at the spinal level, there are all these types of sensory afferents here, which you'll recognize 1A and 2 from muscle spindles, 1B from Golgi tendon and the like, group 3 and 4 down here. And these are potentially all the changes that can occur, some of which are actually potentially helpful. They could increase motor neuron firing and motor neuron output, or they could be inhibitory in some way. And since we know that central fatigue occurs, clearly the inhibitory parts outweigh the excitation parts. So, as I mentioned, despite this muscular wisdom of slowing of motor unit firing to match the twitch relaxation changes, it's clearly only partially compensatory. So it minimizes it, but it doesn't avoid the fatigue. The fatigue still occur. And some of the reasons for this mentioned here, and I'll expand a little bit on that, although I don't want to go over time. So perhaps tell me to hurry up or something if I'm getting too close.
You're fine.
Okay, so transcranial magnetic stimulation stimulates the motor cortex, but it doesn't stimulate it as necessarily exactly as you think. For instance, it doesn't seem to actually stimulate the cortical neurons as much as directly stimulating the corticospinal fiber just below the motor neuron. And it also stimulates interneurons which connect to the motor cortex. So there's an indirect stimulation of the cell body of the, say, corticospinal tract, as well as a somewhat direct stimulation of the proximal axon of that. And the result is a twitch of the muscle, just in this case, something in the thumb. And this is called a motor evoked potential, which is the output one gets from stimulating the contralateral motor cortex. And that's shown here again in what you've seen earlier with the additional twitch on top of the maximal voluntary contraction, showing that there is a little bit extra to be squeezed out of the motor cortex. Now, submaximal, therefore, is generally the case, but we call it maximal voluntary contraction even though there's a little bit extra left in the system. So we have to begin with the idea that there is not 100% activation of the muscle voluntarily, even at rest. And its existence indicates not just that there's central activation failure, but it also supports the idea of fatigue occurring in the central nervous system. In this case, with transcranial magnetic stimulation, it's at the supraspinal level, not at the spinal level. And it generally accounts for about 25% of the force loss of a sustained maximal voluntary contraction. So you have to understand the exercise that's being performed in order to make sense of all of this. And the fact that it can be obtained by stimulation of the motor cortex indicates that the drive to the motor cortex is the source of this central reserve, if you like. So in other words, there's something going on between your desire to produce a maximal voluntary contraction and what you actually can squeeze out of the motor cortex. Something upstream of the primary motor cortex is holding you back. And if that's occurring even at rest, that's likely to be where the central fatigue is occurring as well. And this just shows you this small twitch that occurs during maximal voluntary contraction at the beginning, before exercise is performed, and that's central activation failure. That is the, say, 5% of motor cortex output or force that is being held in reserve. And as the sustained maximal voluntary contraction goes on, this is probably elbow flexors, I think, you see that the force output decreases as expected. But not only that, you see the additional force obtained by stimulation of the motor cortex becomes larger, to indicate that some of this drop-off in force is due to a supraspinal, that is to say, motor cortex fatigue or central fatigue, and it rapidly returns after rest. So supraspinal fatigue is the loss of force that can be attributed to incomplete or suboptimal output from the motor cortex. And studies have shown that it is in general specific to a muscle or the muscle group which is actually being exercised. And so if they vary things a little bit and do repeated elbow flexions and extensions, the antagonist exercise does not seem to influence in any way what's going on in the agonist. So you can be, you know, bending your elbow this way and that, and the degree of loss of force from the elbow flexion seems to have no change, or doesn't change if you're actually exercising the antagonist. And similarly, if you do contralateral exercise of the same muscle, say elbow flexors, that doesn't seem to influence the what happens on the ipsilateral side either. So it's, for the most part, fairly specific to the muscle which is being exercised. Now, there are other changes that occur during a sustained motor maximal voluntary contraction, which I'll talk about. The first thing is that the motor evoked potential, which back here is what you obtain from the muscle just by stimulating the motor cortex, that enlarges, and that you can see that here. So at this point, 2 seconds into the maximal voluntary contraction, it's this size, but then it increases, and you can see that on the right-hand side a little bit better. So despite there being a reduced output from the motor cortex, the amount of the size of the muscle response that one can get, or rather the electrical response from the muscle, increases in size, as does the actual muscle twitch. Now, after a transcranial magnetic stimulation to the motor cortex, there's a brief quietening of the EMG activity, which is known as the silent period. So, in other words, stimulating the motor cortex with the magnet switches off motor output from the motor cortex for a period of time, which you can see here is measured in milliseconds. So this could be sort of 100, 150 milliseconds or so. And that amount of time increases during sustained maximal voluntary contraction. So here it is at rest. And there are two things. One is that it's a little bit shorter, and the other is that it's not completely silent. You can see still little wiggles here, but when it's performed during sustained maximal contraction, it's very flat. So it has a stronger inhibitory effect, which is lasting longer and is more complete as well. So this cortical silent period lengthens. It does so fairly quickly in the course of sustained maximal voluntary contraction, and then plateaus to a certain extent. And then in recovery, it returns to look a bit more like it did in the beginning up here. Here's the recovery section.
And again, the second wave on the tracing there corresponds to a second motor unit firing, which then gets abolished with the cortical silent period?
No, these are not motor units. These are compound muscle action.
Okay, got it.
From the muscle.
And so that second response corresponds to what on the control up top?
Oh, the return of voluntary contraction. So the subjects are told to continue trying to fire the muscle, even though they just got a magnetic stimulation to their motor cortex, which gives a little bump like this, yep. And then shuts them off. But they're supposed to, in the course of this, they're trying to be continuing the action, and they're kind of, if you like, paralyzed for a couple of 150 milliseconds or so before it actually returns.
Okay.
Now, after the maximal voluntary contraction, one can see cortical excitability changes as well. And so the MEP, the motor evoked potential from cortical stimulation, shows a brief facilitation. So this is the before exercise one, and here is the enlarged motor evoked potential, which I showed you earlier as getting larger here. And as you can see, it's sustained for a period of time, but it actually goes lower and will eventually return to the previous size after potentially some minutes or so. Now there's something else which can be done, and that's to stimulate the corticospinal tract at a high level in the spinal cord, so-called cervicomedullary evoked potential, and that's produced by stimulating between the two mastoids. And that can also evoke its own response in the muscle, which is seen here. But contrary to what you get from cortical stimulation, this one is depleted after the exercise is performed and then slowly recovers, in fact, looking a little bit larger, like a rebound of some sort. But these two behaviors here are different. So there's, in the motor evoked potential from cortex stimulation, a brief increase in size and then a somewhat more prolonged inhibition after exercise, as opposed to this, in which during the exercise itself this actually decreases and it's sustained after exercise is over and then eventually recover. And this indicates differences in what goes on in the motor cortex as opposed to the corticospinal tract.
And I'm sorry to have missed this one again, but the CMEP, the site of stimulation, is what?
Upper, very high cervical cord.
And the MEP is cortical?
Yes.
Got it. Okay.
Okay, so cortical excitability actually increases. And that's seen with the increase in the size of the motor evoked potential, as you see here afterwards. But we also saw previously that it increases during the actual contraction as well. So at the same time that there is a failing central output from the motor cortex, the stimulus that one can obtain from the motor cortex actually increases. So there's actual increased excitability of the cortical motor neurons despite the failing output. The cortical silent period does increase, which means that intracortical inhibition is occurring and becoming more intense. And that's seen here. Now, in this particular example, the muscle is exercised and under ischemic conditions. So there's a cuff around the upper arm, for instance, and which accelerates a lot of these changes. But the important thing about this is the difference that occurs at the end of exercise, with what recovers and what doesn't recover if the muscle is held ischemic. In other words, if you don't let blood flow back into the muscle, what improves is shown here. The degree of voluntary activation improves afterwards, but is sustained during the ischemic attack. So in other words, at the end of the exercise, if you don't allow blood to flow back in, the fatigue continues, and that includes central fatigue as well as peripheral fatigue. Let the blood back in and it comes back up again. And similarly, however, in contrast rather, the silent period and the MEP, they recover despite continuing to have the muscle ischemic. So in other words, even though the muscle ischemia maintains the peripheral fatigue and the central fatigue, what happens in the cortex is unaffected by the continuation of ischemia. So it drops back down to 0 levels, as you can see down here. So there's a discrepancy, and that discrepancy has been taken to indicate that what's going on with the silent period and the motor evoked potential, the excitability, the increased size of this MEP, and the increased duration of the silent period is not what's responsible for for the central fatigue. It would seem something else is going on. So supraspinal fatigue can persist without these changes here. So they're interesting, but they're not materially involved in the fatigue. I'll skip over this because it just goes back to that cervicomedullary evoked potential stimulation at the upper cervical cord. And things recover, okay, after about a minute or so. That's probably the main thing to get out of this. Supraspinal fatigue is gone if you let the blood flow back in, that is. So the things that persist, if you maintain the muscle ischemic, are indicated over here. And the important thing is that the studies of the group 3 and 4 sensory afferents from the muscle, they continue to fire if the muscle ischemia is maintained after the maximal voluntary contraction is over. And it is thought to be, seems to be primarily responsible for supraspinal fatigue and possibly some degree of spinal fatigue as well. So the muscle afferents seem to be feeding back to the brain somewhere, probably upstream from the motor cortex, to maintain, or to rather produce, the central fatigue and to maintain it if it's ischemic. So somebody has come up with this sort of system here to indicate that you have your motivation to perform the contraction that's desired, and there's a facilitation system and an inhibition system, and they're working to try to keep the force going, but the inhibition system is occurring to slow that down for some reason. In other words, to produce central fatigue. And we've seen that peripheral input, sensory input from the peripheral nervous system, from the muscle, in terms of group 3 and 4 afferents, which include pain fibers, by the way, feedback somewhere in the central nervous system upstream of the motor cortex. Here's another place where lots of things potentially could go wrong. I'll skip over that. And just to show that there is a difference between submaximal voluntary contraction and maximal voluntary contraction. So let's start with this first. If you sustain maximal force of, say, elbow flexion for 2 minutes, the amount of fatigue which is contributed to by the central nervous system is about 25%. So in other words, the 75% of the fatigue, the loss of force, is occurring in the periphery, that is, within the muscle itself. And only a quarter of it is coming from the central nervous system. As opposed to submaximal voluntary contraction, if you try to sustain a 5%, which is very weak contraction, for 70 minutes, the amount of force loss contributed to by central fatigue is 65%, quite a bit higher. And clearly, if you try to maintain a stronger but still relatively weak contraction, 15% of maximum, for a shorter period of time, there's still a substantial contribution that's actually central. So this makes sense in that there is greater central fatigue with these submaximals, and that's largely related to the fact that with a 5 and 15%, you're probably not recruiting your high threshold motor units, which are readily fatigable, which means that there's less peripheral fatigue, and so the portion that is actually central is higher. So this is just a proportionality thing, but not just that. Central fatigue does last longer than after a maximal voluntary contraction. So something is accumulating which causes this to be sustained. So what's the point of all of this? Well, it seems an obvious intuitive explanation is that this central fatigue and perhaps even the central activation failure, where you can't necessarily get as much force out of the muscle voluntarily as you might, would be potentially to protect the muscle. But the problem is that, as I showed you in one of the earlier slides, the amount of peripheral fatigue in this case is fairly small. There's not a big difference between that and this, and yet there's a ton of central fatigue going on. So it's also clear that task failure, which is another point altogether, as opposed to just tiring, as when you can say, that's it, I've had enough, I can't do any more, that can occur even when there's minimal fatigue in the peripheral system. So something else is up. And it may be that it's important to protect the whole system, because throughout all of these things, there are going to be other changes in the cardiovascular and respiratory system. And there are changes with CNS neurotransmitters as well. Serotonin, for instance, increases central fatigue, whereas a reduction in dopamine and GABA occurs in central fatigue as well. That might be somewhat counterintuitive since we consider that inhibitory, but nonetheless, extra GABA produces extra force, and body temperature can't be ignored either, including intramuscular temperature. So there are other factors which have influenced central fatigue, and it may be that protecting the whole system is important, but nonetheless, why task failure occurs with minimal peripheral fatigue is surprising. So you'll be pleased to hear this is the last of it. Why am I telling you all of this? Well, firstly, I should point out that even though I am less interested in peripheral fatigue, in the situation of peripheral nerve injury, where you have to look at both axon loss and reinnervation one way or another, collateral or self-reinnervation, there will be changes in the muscle. And change of muscle fiber type with reinnervation has been demonstrated in rats predominantly. But nonetheless, that's likely to occur in humans as well. So changing the muscle fiber type, as I mentioned, is likely to have an effect on peripheral fatigue. And the immature neuromuscular junctions which are involved in all of this indicate the potential, and also which has been found, for neuromuscular junction failure. So those immature neuromuscular junctions could fail. In the normal person, they don't. But when they're immature as a result of collateral or self-reinnervation, they can fail. It also makes me interested in what happens to central activation. You know, how much force can you get voluntarily out of the muscle? Is there an increase in that, and potentially also an increase in central fatigue in a muscle which has undergone axonal loss and also undergoing reinnervation? It also indicates, along with the neuromuscular junction here, which might be immature, that the motor axons themselves, which might not be very mature, could show activity-dependent or frequency-dependent conduction block. And that has been demonstrated as well in patients with polio, with spinal muscular atrophy. And when a nerve has been injured, we can't ignore the changes in the sensory innervation of the muscle. So reafferentation, it might be quite different. And as we can see, at least group 3 and 4 afferents have a role to play in central fatigue. And fusiomotor drive doesn't seem to get much attention at all. These are the motor fibers that drive the muscle spindles, contract the muscle spindles. If there's a change in the reinnervation there, that could also influence fatigue. So I'd be quite interested to look at what is going on under these conditions up here, axon loss and reinnervation, mostly because it's been hardly studied at all, surprisingly. So this is potentially an opportunity of research for Dr. Brown, who's always looking for things to do, and in which I might be able to help. So anyway, I'm grossly over my time, I suspect. Luckily, I don't.
That's all right. No, that was, this is the kind of lecture I think I need to hear about 3 times before I fully get it. We are over time, but let me ask you that one last thing. In our recovering nerve transfer patients, I'm guessing that the primary limitation on these guys after they hit their plateau is going to be on the muscular level, but I guess I'm curious as to how much central drive plays a part in all that. Just wanted to get your thoughts on that.
Yes, well, from the very few studies which have looked at central drive in these instances, it's fairly clear that it is increased over normal. So something.
The central drive is increased.
No, sorry, I'm referring to central fatigue. Central
fatigue is increased, yep. Okay.
Yes, central activation failure is also increased, whether that's from a muscular disease, like a muscular dystrophy of some sort, or from a nerve thing. So central activation in general, which of course has to be related to central fatigue, is increased in the very few studies that have been done. But I think there's opportunity to look at this more closely.
Yeah, absolutely. Hey, thank you very much, Geoff. I appreciate your time. And we will be circling back with you. I just pinged Ross and said we need to look at some of this stuff. And he's running back and forth between patients and your lecture. Well, we've got you recorded, so we're going to revisit it. But thank you very much. I appreciate it.
Okay. Thank you all. Bye-bye.
Bye.